Well, thanks for coming on, Nick. Maybe you can take the lead.
Yeah. Yeah, absolutely. And again, thank you for coming on. I know
Of
you spoke to Harvard twice this week or something. I know you're
Yeah,
busy. I'm just going to introduce you real quick, and
of
this
course.
is Dr. Michael Breus. Did I say that correctly?
Yep, Bruce like Zeus.
Awesome. He's a clinical psychologist, a diplomat of the American Board of Sleep Medicine, and a fellow of the American Academy of Sleep Medicine as well. He's also one of the youngest people to have passed the board. So you were 31 when you passed the board?
Yeah, I was. It was kind of interesting because I did something a little bit unique besides being like the Doogie Howser of sleep, which was actually a nickname that people called me all over my office. Like they had to get me the jacket that said Dr. Bruce on it because nobody thought that I was really the doctor type of thing. Um, it was kind of funny, but I'm one of the youngest. I'm actually the youngest person to have ever passed the board without going to medical school. So I took the medical boards without going to medical school and passed. I'm one of 168 people, I think, who've ever done it.
That's awesome.
And your life now, and I've seen you on, I've read your book. What is it? The Power of When?
Yeah,
The
thank
Power
you.
of When. Great book. I've actually read a lot about the chronotypes. You talk a lot about the bear and the wolf and all that
Yeah,
stuff. Big fan.
thank
But your
you.
life is dedicated now to sleep, right? Just
Yeah,
optimizing sleep.
yeah, absolutely.
Awesome. So what I would love is what we have. I'll share a little bit. I know we
Please.
talked about this before. We have a lot of high performing people on this call.
Yep.
There are going to be private clients of mine, private clients of Dan's,
Mhm.
by and large business owners. Probably every single one of them is a business owner.
Mhm.
And you work with a lot of high performing business owners. You know that one thing we don't do really well is like
Relax.
slow the F down and go to sleep. Yeah.
Right.
And you said something really interesting to me that I want to share, and I'd like to start off with this.
Sure.
Is you said to me there's a difference between disordered sleeping and a sleep
disorders.
disorder,
Yeah, yeah,
and what you have is the magic to kind of cut through and resolve a lot of the disordered sleeping stuff.
yeah.
And
Yeah.
so knowing the audience, what I would love is to start there, because
Perfect.
that's most people are popping on here saying, man, if this guy can get me to sleep better tonight, especially amongst all this chaos, it's totally worth the time, worth the effort showing up. And then a little bit about after that, and we can circle back a little bit about this whole coronavirus ordeal
Yes.
and how do we deal with the added stress, the added chaos, the added uncertainty, and what can we do to sleep better? It's already hard enough to sleep, and now we're watching our portfolios tank and all this stuff.
Right.
So I would
Yeah.
love to just give you the floor and let you go.
Can I
Well,
plus?
I am happy to step right in and jump on top of that. Dan, did you have something to say before I
Yeah, I
started
just
up?
want to maybe plus one thing as you answer Nick's initial question, and maybe you would have just naturally done this to begin with, but
Mhm.
I'd love to kind of hear in there why someone of your intellectual bandwidth and like you said, the Doogie Howser reference that people gave you, what made it that so that you are so interested in this specific area, sleep in particular, because I'm imagining that also informs some of the things that you, the reason why you have uncovered what you have.
Absolutely, absolutely. So I'm going to actually, if it's okay, Nick, I'd like to start with Dan's question first because it'll give people a little bit of background on me, and then I'm going to go into answering yours if that's okay.
Absolutely. Perfect.
Awesome. So thanks again for the question, Dan. And first of all, introductions to everybody. Hi, Michael Breus. I have a PhD in clinical psychology. I'm board certified in clinical sleep disorders. You heard me talk a little bit about that previously. How did I become a sleep doctor really is kind of an interesting story. So to be fair, I've always been interested in performance. It's been something that I've always felt like was something that was hackable, was teachable. I personally believe sleep is a skill set. Okay, it's very simple. I believe that sleep is a performance activity. And if you have the right equipment and the right coaching, you will do it well. It's honestly all about that. I'm a very practical, straightforward kind of person. When I started in all of this, it was a little bit different. So believe it or not, originally, I wanted to be a sports psychologist. I'm a lot like Mike Gervais, which is why we actually have so much in common together.
Very cool.
I wanted to work with athletes and have them throw faster and run, do all these kind of cool things, right? The best program in the country, believe it or not, for what I was interested in was at the University of Mississippi Medical Center in Jackson, Mississippi for the residency. I'm from Sandy Springs, Georgia, so it didn't really bother me to wander over to Jackson, Mississippi and kind of check it all out. But the program for sports psychology was completely full. They had already accepted their people and there was no more room. However, they had a sleep track that was available. And I had worked my way through graduate school as an electrophysiology technologist. So I know how to take apart machines that monitor body signals and be able to interpret that data. It's just, I'm kind of a wonky, geeky kind of guy. And so that was kind of the thing I learned how to do. Turns out those machines are exactly the same machines that they use to measure sleep. So here's what my mind taught me, and everybody on this call can actually appreciate this. I said, well, if they're not going to let me into their sports psychology program, I'm still going, whether they like it or not. I'm going to go onto the sleep side, and I'm just going to fucking transfer over to the other side and get where I want to go, because that's how I do things. My guess is everybody on this call has the same mindset. So I sold myself as the sleep guy. And I got there and they said, oh, you start your sleep rotation. I was like, hey, I want to transfer. And they said, can't transfer until after the first quarter, start your rotation. By the third day, I absolutely fell in love with clinical sleep medicine. And I knew that was where I was going to want to be. To be honest, guys, I help people like this. It's unbelievable. You change somebody's sleep, you change their life. And from a performance perspective, I have learned over 20 years, the secret weapon, the secret ingredient, I don't care if you're an athlete, celebrity, politician, or billionaire, because I deal with all of them, sleep is the common factor for performance. You just can't do shit unless you're well slept. And remember, sleep is not just a quantity issue, it's also a quality issue as well. And that's where, Nick, I think we can jump into the idea of what's the difference between a sleep disorder and what I call disordered sleep, right? Sleep disorder, apnea, narcolepsy, restless leg syndrome, all of which I can help people with and treat and find the right laboratory to do things with. But to be honest with you, I wasn't nearly as interested in that as I was in disordered sleep. Disordered sleep is more like you go to that room in the back of your house, you go in there for a couple, 5, 6, 7 hours, turn off the lights. Hopefully you come out rejuvenated and refreshed. Most people don't. Specifically, most people on this call probably don't, because you've got a million things going on in your brain. You're here, you're there, you're everywhere. And so what I decided to do recently, since I moved to Los Angeles, was develop a sleep optimization program and pathway for people. Because here's the thing, everybody that's on this type of call is a high-powered alpha individual. And you got to get a lot of stuff done. You have a short amount of time and you got to be on point all the time. And not just business-wise, emotionally, family. I mean, the list goes on and on. So one of the things my goal has always been is to teach people the idea that you don't have to worry about sleep, because once again, this is a skill set. So there's a lot of different aspects to it to think through. And from a Corona perspective, I'm going to talk about that a little bit, and then I'm going to get into some of the tips and some of the tricks and some of the things that people can be utilizing right now to be able to help them sleep better right now. Is that okay? Am I doing okay, Nick?
Wonderful.
Absolutely. Keep rolling.
Perfect. So when we look at Corona, the reason that we're thinking about sleep when we think about Corona is because of immunity. So we now know that of all of the natural processes that you can do, sleep turns out to be the #1 way to improve immunity. Now, to be clear, you need high quality sleep. It's not just any sleep that will do, but you want high quality sleep. And here's what happens when the sleep quality is improved. We see that killer T cells improve in terms of production. Killer T cells are basically the white blood cells that show up in areas of infection or in areas of trauma and fix things inside your body. If you're not sleeping well, you have a lower T cell count. That's not good. If you remember back in the 80s when we were talking about things like HIV and cancer, there was a lot of talk in the media about killer T cells and the need for those to be high to fight infection. That hasn't really changed much at all, and sleep is a great way to go about doing that. The second thing that's important to recognize, in 2017, there was a really interesting study done at the University of San Francisco, and what they discovered was people who had high quality sleep, if you gave them the flu shot and then exposed them to the flu, they didn't get the flu. people who did not have high quality sleep, who got the flu shot and then were exposed to the flu, almost 80% of them contracted the flu.
Wow.
We're in a time where I think this analogy makes a lot of sense for people to be thinking through. So what we really want to do is we want to make sure that we can improve that sleep quality. So the next question you're going to say is, all right, Michael, we get it. We need higher sleep quality to fight immune function, to be able to do our best in this. What are the things that we need to do to improve that sleep quality? Because so far, nobody's really told me a whole lot. So there's several very specific things. So number one is we want to look and make sure that all of the vitamins and minerals that are in your body are up to the par levels that they need to be in order to fight infection. There are 5 different things that I'm recommending to people to think about. Number one is zinc. Number 2 is vitamin C. These are well known. You've seen these all over the place. There are 3 others that you haven't heard about yet. Magnesium turns out to be incredibly important for sleep. Iron, for people who are iron poor in terms of their blood, that can become a pretty significant issue. And vitamin D, specifically D3 is what you want. Looking at dosages, in D3, you want about 5,000 international units. You want to take it in the morning. You cannot overdose on vitamin D, but you don't really need more than 5,000 international units. It will not have an effect on your current medications that you might be taking. So that's always something to think about, by the way. If you're taking a medication and you're adding a supplement, you want to make sure that there aren't any interaction effects or any side effects that could occur based on something that could be going on there. But the 5 again are D3, you want 5,000 units. Magnesium, you want about 250 milligrams of magnesium. You can get that in the evenings. There's a great powder out called Calm. My favorite magnesium is actually created by a company called Jigsaw. Nick, what I'll do is I'll send you a link that you can send out to everybody afterwards, because they have a special sleep magnesium powder that I've personally found to be quite good.
Awesome.
So that could be helpful for folks. When you look at vitamin C, honestly, almost any vitamin C will do. If you can get liposomal vitamin C, that seems to be absorbed quite a bit better for people. And again, this can be quite helpful in fighting off infection. You don't have to go crazy with vitamin C. I think, I'm not sure what the current recommendation is. I'm not sure if it's 200 or 300 milligrams in a day. You really don't need a whole lot more than that. Be careful. You don't want to ever overdose on vitamin C because that's just not a whole lot of fun. From an iron perspective, you do not want to start taking iron unless you know that you might be iron deficient. For folks on this call, if you're not, you might have a partner who is. In particular, I don't know how many women are on the call, but women, especially women as they're going through menopause or menstrual cycles, can have dips in their iron, and this can be an important factor for them. So in some cases, if you're getting 325 milligrams of iron sulfate, you can buy it at Walgreens for 10 bucks, can be a good supplement. Be careful if you're taking iron, it can cause a small level of constipation in some people. So make sure that you've got a little fiber and that you stay well hydrated, because that can be important as well. Looking past the vitamin issue, let's talk about what else can we do. It's really about consistency of your sleep schedule, right? If normally you wake up during the week at 5:30, you need to be waking up at 5:30 during this period of time. Keeping what we call a circadian consistency turns out to be incredibly, incredibly important during this particular time. Now, saying that is important pre-exposure to corona. If you are exposed to corona and you actually get the coronavirus, you're going to actually increase your total sleep time, because remember, sleeping is healing. That's what we do when we sleep. And so during that period of time, you're going to actually have increased levels of sleep. But let's continue to talk about prior to exposure to corona and ways we can fend that off. I'll end the discussion with several things that people can do if you are infected or if you're not feeling well. So step number 1 is keep your schedule consistent. Number 2, you should really find out what your chronotype is. Nick was talking about it earlier. In my book, I've got 4 different chronotypes, and we can give you a link to the quiz. If you haven't heard of the concept of a chronotype, you actually have probably already heard of the idea. it's early bird versus night owl. So it turns out that if you fall asleep based on your genetic predisposition of being either an early bird or a night owl, and there's actually 4 different types out there, you actually improve the quality of your sleep. So let me give you an example. I turn out to be a night owl, what I call a wolf. If I try to go to bed at 10 o'clock, I don't fall asleep. In fact, if I do fall asleep and I monitor my sleep is very fragmented and very light. If I wait until midnight to go to sleep, I fall asleep almost immediately, and my brain goes almost immediately into deep sleep, because this is my genetic propensity for sleep. Very easy to evaluate, chronoquiz.com. It will literally take you less than 2 minutes to figure this out. Okay, so that's number 2, is keep your schedule consistent and make sure that you're on a schedule that is consistent with your personal chronotype. That's going to be very important. Step number 2 during this whole kind of insanity is you really want to look at alcohol and caffeine. Okay, it's very easy to drink a bunch of coffee. It's very easy to, you got a wine cellar. Why don't we crack open that bottle that we've been saving? And not the best idea currently. Alcohol has the opposite effect on the immune system. It actually deters the immune system. So you really want to avoid alcohol if you can, especially if you feel like you've recently been exposed, or you're concerned about your overall kind of level of health. Can you have a glass of wine or a shot of bourbon? Yeah, of course you can. But you don't want to go too far. So if you're going to do it, give yourself a limit. I would argue that you want to have less than 2 to 3 alcoholic beverages in an evening, and keep it at that. Again, if you can go 0, you're going to be better. But if that's going to help relax you and calm you down, and that's kind of your evening ritual, go for it. Caffeine is a problem only from the standpoint of we've already got people who are scared. And let's be very honest. People on this call might be scared. Not scared like, oh my God, the world is going to end, but like, holy crap, what do I need to do? What do I not need to do? When you add too much caffeine on board, you really start zooming your brain. And you start to go down pathways that are not really particularly healthy. So keep an eye on your caffeine. And if you can, start to slow caffeine down by about 2 o'clock in the afternoon. That gives you a half-life of almost 8 hours to get it out of your system by about 10, which can be very helpful for you as well. Number 3, keep up an exercise routine. If you're not an exerciser, do it anyway. And we're not talking about, trying to run a marathon, which obviously would be tough to do during quarantine. Although it's kind of funny. I saw a story last week. There's a guy who ran a marathon in his apartment. He had 25 feet of clear space, and he got a pedometer. He was there for like 6 hours, and he did the whole thing on social media. So to be clear, you could actually run a marathon in your apartment, but that's not what I'm asking you to do. What I'm asking you to do is have 20 minutes of cardio, some form or fashion. Here's the reason why I want you to do this. It's a way to take your temperature to see where you are on the COVID scale. If you start working out and it's much more strenuous and it's much more difficult than it usually is for you, you need to take a look at that, because this is something that's going to sit in your respiratory tract, and it's got a 2-week gestation period. So as an example, if you go out for a run, or you get on your bike or a Peloton or whatever the thing is that you're doing, and all of a sudden you're like, wow, it's really hard for me to start doing this. Slow down, take a step back, and start to look at some of the other COVID symptoms to make sure that you might not be one of those people. If you're still exercising at your normal kind of pace, go for it. Make sure your exercise time is consistent as well. So your wake up time is consistent, your bedtime is consistent, and your exercise time is consistent. The reasoning for this is because that way we know that our bodies will respond and know when to respond. Again, based on your chronotype, this is going to be quite helpful. A couple other things to think about. Try to avoid napping, right? There's no reason to be napping during the day. It's easy to do, and what it does is it will prevent you from being able to fall asleep in the evenings, because you have a certain amount of what we call sleep drive that builds all day long. And if that drive gets diminished because you take a nap, it's just going to make it that much more difficult to fall asleep in the evenings. A couple of other things to think about is washing your sheets. A lot of people aren't thinking about this, but we're all spending a lot of time in bed. We're all probably sweating quite a bit. So one of the things to think about is you really want to make sure that your sheets get washed a minimum of 1 time per week. I would argue that you want to change them out about every 3 to 4 days. So if you have multiple sets of sheets, I would consider doing that. Also, we know that, believe it or not, the COVID actually doesn't do well in heat. So as our environment starts heating up, as we start walking into spring, what we will see is we'll see a reduction in COVID exposure and things like that, which will be helpful. However, as it gets hot out, it's harder to sleep. So one of the things you want to do is make sure to keep your sleep environment as cool as you can. Somewhere between, if you got it 75 to 65 degrees, I know that sounds like a meat locker, but I promise you, what we now know is that when the core body temperature drops, that's a signal to the brain to release melatonin. So what we don't want to have is people getting overheated in the evenings. Also, this is one of the reasons why we don't want people to exercise too close to bedtime. So if you've got an exercise routine, see if you can do it before dinner. Anytime in the morning or afternoon time is going to be helpful for you. In addition, if you find yourself getting tired in the afternoon, getting a little exercise will give you that added energy boost, especially for you early morning, what I call lions. So for folks out there who wake up at 4:30 in the morning and by like 3 o'clock in the afternoon, you are dragging ass, the best thing to do is to do, get some jumping jacks going, some push-ups going, like something, go outside, get a little sunlight. That's going to be extremely, extremely helpful for you as well. A couple other things to think about are foods. This is the time everybody's going to gain weight, okay? And here's why. We've all bought a bunch of processed, shelf-stable crap that's going to sit in our pantries, and that's a lot of what we're eating. And 99% of that is loaded with sugar, preservatives, things that we really don't want. Be careful. You should be weighing. If you've got a scale, weigh yourself every morning. Keep an eye on it, okay? If you see it start creeping up, start to pare back. Me personally, I'm an intermittent faster, and this is a great time if you're interested in intermittent fasting and something that you want to do. That could be incredibly valuable here as well. I wrote an entire article on intermittent fasting and sleep. It's available on my website. So Dan and Nick, if we can maybe give them the link, I think that could be helpful for folks there. So thinking about that, I would argue try and stay with the whole foods. Try and be cooking many of your meals if you can internally in your home. There's now some data to suggest that, in fact, that COVID can be on an inanimate object. So if you're buying food, let's say takeout food, and there's somebody there that, however, got exposed to it, there is data to show that it could actually be on the container that you're bringing into your home. So one of the things that I'm recommending for people, and don't go crazy with this, but have a set of bowls, plates, dishes, whatever it is. So when you're bringing your food into your home, you have an area where you can transfer that food out of those containers into your washed containers, and then leave those packages outside your door if at all possible. The second thing that you want to do is, and again, not trying to be paranoid, just trying to be practical, take your shoes off before you walk into your home, and wear socks on your feet while you're walking around your home. There's two reasons for this. One is there's some data to suggest that COVID can actually be on your shoes and you'd be bringing it into your house. But what you don't want is your bare feet on your floor. Two reasons. One is it could get cold, but number two, again, you don't want to have that skin exposure to the possibility of COVID. So just keep your socks on and you should be in good shape. Don't get crazy. Okay, it's very easy to get onto the paranoid side of this and start to try to do everything that there is to do. Most people will survive Corona just fine. Now, to be clear, if you're taking an immunosuppression drug, if you're recovering from cancer treatment, if you've had a transplant or you have a family member or loved one that has, get them officially quarantined for a while, right? These people do not need a level of exposure at all because they already have a decreased immune system or function. So if you have one of those people in your home, keep them in your home, keep them in one part of the house. You don't want to be the person that exposes somebody like that to this scenario, right? Now I was going to go into, Nick, but I'm happy to answer a couple of questions for people if they've got them.
Yeah, we got a few coming in if you got the time.
Yeah, let's do that. And then we'll talk about what happens if you get sick. How should you change your sleep patterns? We'll do that after we do all the Q&A. So let's roll with some Q&A.
Cool. Real quick. Do you still need vitamin C if you are following the keto diet?
Probably not. There's some evidence to suggest that it may not be a factor, but to be really honest with you, it can't hurt.
Yep. Plus some.
Yeah.
Alistair's always got the good questions. For those of us with sleep apnea and using a CPAP, are there any specific suggestions?
Yes. So for folks out there who are using a CPAP, number one, clean your CPAP daily. Remember, this is a respiratory thing. One of the things I'm telling people right now, the ozone cleaners that are out there, I think there's one called So Clean. There's a few others. Those are fantastic. They really do knock it out. And once you've gotten the ozone through it, if you then allow the ozone to dissipate, there apparently are no side effects from something like that. So I would say absolutely, you want to make sure that your equipment is clean. Also, make sure that you're using the humidifier. Oh, and that's an important point I want to bring up to people is, well, this is more for if you get COVID, but at the end of the day, it produces a very dry cough. And so adding humidifiers and things like that can be very, very helpful for people during this period of time.
Any specific suggestions for those of us who travel frequently?
Yes.
Best tips on adjusting jet lag and impact of time zone. I'm going to tie in the next question too with it, if that works, because the next question is there any benefit to taking melatonin as a supplement?
Got it. Okay, so those are very different. Well, they're kind of related. So let's back up for a second. So if we're talking about jet lag, it's easy. So everybody on the call, go to www.timeshifter, timeshifter.com. Full disclosure, I helped develop this and I'm an investor in this company. This is an app that you download to your phone and it uses melatonin, napping, light, and caffeine in a very particular order based on where you are and where you're going. It will completely obliterate jet lag, completely. I've used it on multiple occasions. To be fair, I have a version of it that's a little bit bigger and better. And so for a lot of my clients, and I'm happy, Dan and Nick, we can talk about this as maybe a service that we can offer, is I do jet lag management. So to give you an example, one of the people that I work with is an entertainer and he does almost 200 shows a year. And we're working with him on his levels of jet lag. If I can fix him, I can pretty much fix just about anybody else out there. But jet lag is absolutely one of the big issues. When we talk about melatonin now, we have to talk about it from a jet lag perspective, but I think it's also worthwhile talking about it from a COVID-19 perspective. So from a jet lag perspective, absolutely, I love melatonin. It works well. There are different brands out there. Some are better than others. Me personally, there's a brand called Herbatonin, Herbatonin. This is the only company that I have discovered that actually is extracting melatonin from an organic source that is non-human and non-animal. This is actually extracted from a particular type of grass, and it's actually incredibly effective. I've had some really good luck using this Herbatonin. Now, when you look at melatonin, Herbatonin, whatever you want to call it, for COVID, there is now some data to suggest that its antioxidant effects may be helpful. Oh yes, this Alistair put out, if you're a United 1,000 miler, you actually get this app for free. We actually just did the deal with United, so it is the time shifter deal. It's pretty cool actually. So melatonin during COVID may or may not be something that's important. What I'm going to do is I'll make a commitment to everybody on the call. I've got a little bit more reading to do before I put out a blog, but Nick and Dan, I'll get you the blog on melatonin and COVID. If you wouldn't mind maybe distributing it out to the group, that would be helpful.
Sure. Yeah, absolutely. Absolutely.
Cool. Next question.
Awesome. That's
yeah, I had a couple questions.
Yeah.
So when you're going down the list of vitamins, one of them you mentioned was magnesium. First,
yes.
I guess maybe for some folks who have digestive issues, I know that
yes.
magnesium can be a little bit
Yeah.
unsettling for you in the morning? Curious.
Yeah, for sure. So, Dan's having a very nice way of saying that if you have too much magnesium, you end up with this scenario called disaster pants. Okay, right? And that's clearly what we want to avoid, right? That's what you're talking about, right?
100%. Yeah.
So with some people, a decent amount of magnesium can certainly loosen your stool and cause diarrhea. And so one of the things to think about is if you're going to start a magnesium supplement, and again, I like Jigsaw quite a bit, take a half a dose first and just see how your body reacts, right? Here's the good news. You're quarantined, so you're probably only about 15 steps from the bathroom anyway.
That's right. Yeah, there have been some kind of recent commentary around how diarrhea and digestive issues can be somewhat of a tell of COVID.
Right.
And I wanted to bring that up of if you start magnesium and then in a day or two, all of a sudden
excellent
you have
point.
Stomach issues. It may not be that you have COVID. It may be just by virtue of the fact that you start taking magnesium.
Yeah. Oh no, there's no question. Hold on one second. I just got a text. I just want to respond real quick and just tell them I'm busy for the next 20 minutes.
Sure.
Give me 20.
And then I was curious, just your take on like the whole consumption of like looking at your phone before you go to sleep or watching TV and all the blue light and stuff.
Absolutely.
That's out there.
So here's what I'm going to tell you about all of this, right? So I'm the only sleep doctor in the universe that says it's okay to fall asleep with the television on. I'm the only one. I'll tell you why. When I met my wife, she told me, Michael, if we ever have a sleepover, I need to let you know something. I fall asleep with the TV on. I said, don't worry about that, honey. I'm a sleep doctor. I'm going to fix that. I don't know about how many of you have ever tried to fix anything in your bed partners before. It doesn't fucking work. I pulled the TV out. She said, get your butt out of the bedroom. I put the TV back in. I got back in the bedroom. So I'll give you one guess what happened. The TV stayed in the bedroom. So the question became, why does she need the television to fall asleep? And it turns out she's not even watching it. She's listening to it, right? And so this is a great distraction tool. 99% of the televisions out there have got timers built into the software. All you need to do is set it for 3 hours to turn off and then let it go. The difference, however, is if you're using one of these, right? Proximity becomes a factor. Television's all the way across the room. I got blue light. It's literally 18 inches from my nose. So that's not good. But let's talk for just a second about what is blue light. Blue light is a particular wavelength of light that falls between the 460 and 480 nanometers. The reason that becomes important is when it hits a particular cell in your eye called a melanopsin cell, it turns off the melatonin faucet. If you've got blue light exposure in front of your eyeballs, 18 inches away, right before you go to bed, you're telling your brain not to produce melatonin. That isn't a good idea. Television all the way across the room, I don't think I have a big problem with it. Now, let's say you still want to check your Facebook or whatever, wear blue light blocking glasses. Full disclosure, I made my own line because quite frankly, I couldn't find any that I like. If you go to sleepdoctorglasses.com, you'll see them there. They're awesome. I actually created them for my children because they're gamers and I wanted to make sure that they wouldn't be up all night. So that's definitely something that you can utilize. But here's the other thing to think about is engagement, right? If you're trying to get your high score on Candy Crush before you go to bed, I got news flash for you. You ain't trying to sleep, right? So you need to, again, give yourself some runway, right? Like sleep is not an on-off switch. It's more like slowly pulling your foot off the gas and slowly putting your foot on the brake. Like there's a process that needs to occur. And I think that's going to be important. People often ask me about the night shift mode on the iPhones. So there was one study done at Rensselaer Polytechnic Institute that showed that it has no effect. So night shift mode does absolutely positively no good. Better that you get, they make these little shields that you can put on your phone that will do something like that. I think it's called Accu Shield. That's ringing a bell in my head somewhere. We may have to look that one up. But that could be something that could be valuable to use. But don't go crazy with worried about the blue light, right? Media likes to make a big deal of it. There are a couple products out there that you can utilize for it. But at the end of the day, the likelihood that that's what's keeping you up is probably less so. More so what's keeping you up is between your ears, right? It's about anxiety. So we need to distract ourselves before we go to bed. With all the people that are on this call who are in high-powered positions, one of the things that happens is, unfortunately, you don't have any time of day to sit there and think, right? And so what ends up happening is when you lie in bed and you turn off the lights, guess what? All the thoughts come flooding in, and then your mind is just going, going, going. So what I like to do is I like to do distraction techniques. So I'm going to send Dan and Nick my audio file. Actually, I think it was on, you can download it if you go to the link that I sent you guys from before, the COVID link. You know which one I'm talking about?
Yeah, I have it.
Okay. So let's also make sure that everybody can get that audio file, because that's going to be helpful. And that's a progressive muscle relaxation technique that you can do before bed. But you know what? Meditation works here, prayer, reading, whatever it takes to get you there. But guys and gals, remember, it's really about settling in, right? It's hard to go from, Mach 3 on fire to comatose. You really have got to give yourself that opportunity to get there. And I think that's going to be important.
I have one more question before we, if it's okay, we're okay.
As many as you want, dude.
Any take on body position?
So body position is interesting. And then we can talk about what happens if you do get COVID and some of those types of things. So the best position, physically speaking, for your body is to sleep on your back. Displacing weight across the skeletal frame is easiest when you're doing that. Oddly enough, 75% of people are side sleepers. So that forces you to lie on one side and you get what's called capillary crush. So the outermost vessels that distribute blood become crushed because of pressure. It only takes about 8 pounds of pressure to actually crush a capillary. So what happens is your body's going to have to shift, and that's where some of the tossing and turning can come from. If you cannot fall asleep on your back, there's a reasonable likelihood that you might need a new mattress. Something to think about. We could do a whole thing. I can teach everybody in here how to buy a bed, and pillows and things like that. And you know what? We might want to do that maybe next week. If we're thinking about it here, but that could be an indicator as well. The worst position to sleep in, however, is on your stomach, right? Because what happens is you have to jack your head all the way to the side and it causes neck strain. To be fair, not only am I a night owl, but I'm also a stomach sleeper. Like, I do all the wrong stuff, guys, just to be clear. But again, this is about adaptation and this is about optimization. So things that might affect me might not affect you, and things that affect you might not affect me. If you're a stomach sleeper, whatever you can do to stop being a stomach sleeper is probably going to be a good idea here. But position can have some effects on your ability to get quality sleep.
Okay, thank you.
Of course.
Awesome. One more question, just here in the chat here, is the Baxter Holmes article on the NBA and sleep. Have you seen that?
I have.
Any thoughts about the conclusions that were reached there?
Which conclusions in particular? Because basically it's that athletes are not getting enough sleep and these guys are getting just jammed up. Or is there something in particular? I'll let
Alistair see if he wants to chime in.
Yeah.
I remember he actually sent me that a couple months ago. He sent me that article. In the meantime, you want to talk about, I don't want to take up too much of your time. I just so greatly appreciate it.
Let's talk about what happens if you get COVID or you get sick, some of the things to think about. So remember, historically, we were just talking about getting sleep and being consistent in your schedule. You would actually do almost the opposite if you contract COVID. You need more sleep, not less sleep. You need to nap when you've got COVID, things like that. So that's number one, is if you do get COVID, you need to increase your overall total sleep time. At that point, absolutely load up on the vitamin C, the zinc, things like that. That can be helpful. You want to take your bed and instead of lying flat, you want to raise it so that you're sleeping and sitting in more of an upright position. The reasoning for this is if you're lying flat on your back, all of the anatomy has a tendency to push towards the back of your throat. That can cause a throat spasm, and the dry cough that COVID is known for will kick in and you will not be able to stop. Also, when you wake up in the mornings, and this is a good idea just in general, if you have a totally enclosed shower, turn the water on the hottest you can, not to be touching you, but to create steam. You need to be breathing in this steam. If you have any eucalyptus, that can be helpful during this period of time as well. But keeping your whole nasal and respiratory system well hydrated is going to be important from a humidity perspective, because it makes it easier for you to breathe for sure. Other things to really think about, don't overdo it. This thing is going to knock you on your butt. I've talked with a 25 and a 26-year-old who got it, and then their mother who's about 40. And the young men, it was literally, it knocked them out so hard that when they stood up, it was hard for them to walk from one room to the other. These are 25-year-old healthy kids, right? So there are different responses, different things can happen, but at the end of the day, if you get it, you got it, and be smart about it. Try not to expose anybody else. Try not to do too much. Just keep your body as healthy as you can by getting good rest and following the recommendations. If you spike a fever, you got to call your doctor and you got to tell them and let them know what's going on. Because the problem is once you spike the fever, if the fever doesn't break, you can end up with pneumonia. And then you may have to, depending upon your ability to breathe and lung capacity and things like that, you could end up having to be put on a ventilator. So that's not something that can be done in the home. So that's definitely something that if you spike a fever, call your doctor immediately. You're probably going in.
Great.
Awesome.
Does that make sense, everybody?
It did. Yeah. We got a question about how you can keep your nasals hydrated. It sounds like you suggest the shower. What about like a nebulizer?
There's a spray. So there's something called Air, AYR. You can get it at almost any drugstore. It's like little nasal drops that you just tilt back and you can punch into your nose, and it'll keep that whole area up nice. Humidity is always a good one. So the steam and the heat from that will work. Also, just a saline rinse could work well. If you have a neti pot or something like that, absolutely. Like I would do that whether you're COVID or not. I would do a neti pot almost every morning because that irrigates the whole area, keeps it nice and working well. Also, it'll flush out any gunk or stuff that might be lying around in there.
Wonderful.
Awesome.
Yeah, this was so great. Thank you for coming on. We really appreciate it.
Look, it's my absolute pleasure. Nick and I are very close friends with a friend of ours named Dr. Jeff Spencer. And when Jeff told me about you guys, I was like, let's get in there. Let's help this group out. Let's educate.
Awesome.
I appreciate that. I spent about 2 hours with Jeff last night. Such a great human being.
Really is.
Awesome. Well, thank you so much. What I'll do, I'll send you this replay and I'll send you all the notes so you can look over, make sure all the links are correct and all that stuff. And
perfect.
Obviously anybody on here, I'll make sure that you get the replay and the notes as well.